SI joint pain. Are you tired of relying on medications or quick fixes that don't last? In this video, I'll show you my 5-step proven treatment process that has helped thousands of patients find long-term relief without surgery, drugs, or complex exercise routines. Like Heidi, who had been dealing with chronic SI issues for over 30 years after being involved in a car accident when she was only 17. And after going through this same 5-step treatment process, she achieved lasting relief from her pain and was able to return to all of her normal activities of daily living, all without pain. I'll cover everything from specific diagnostic techniques to targeted adjustments, plus a simple 10-minute home exercise routine for lasting stabilization and relief. You'll also learn why past treatments may not have worked for you and how this 5-step approach could be the game changer you've been looking for. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I've been helping patients overcome chronic lower back pain, sciatica, and neck pain, all without medication, using specific corrective chiropractic techniques. If you're busy with work or home life and dealing with chronic spinal conditions, this channel is dedicated to helping you. Here you'll find exercises, expert tips, and proven strategies aimed at managing and preventing back and neck pain so you can stay active and pain-free. But before I dive in, subscribe to my channel if you want more tips and strategies to help you achieve lasting relief, improve your mobility, and regain control of your life, all without relying on medications or surgery. For those struggling with chronic SI joint pain, it's common to try remedies like stretching, medication, or rest. However, these approaches often fall short because they don't address the root cause of the pain. Stretching alone might temporarily ease muscle tension, medications can mask the pain, and rest provides only short-term relief. But if the underlying dysfunction in the SI joint isn't corrected, the pain inevitably returns again. That's why step 1 in our 5-step process is so crucial. It focuses on identifying and addressing the specific cause of your SI joint pain. By targeting this root issue, our approach sets the foundation for long-term, sustainable relief, allowing the other steps to work effectively and creating lasting relief. In step 1, I begin with a thorough consultation and examination. I'll look at your health history to see if anything like past traumas, injuries, or car accidents could have contributed to your SI joint pain. I'll also ask about your work and daily habits to understand how your posture routines may impact your SI joint. Then during the exam, I check for misalignments in your spine, pelvis, and sacrum, as well as posture or muscle imbalances. I'll also take x-rays, which are essential. They show exactly what's happening with your spine and pelvis, so there isn't any guesswork about the cause of your SI joint pain. One specific x-ray that I take, which is often overlooked, measures the anatomical length of both legs. If one leg is just a little shorter, it can tilt the sacrum and pelvis, leading to extra strain on the SI joints. If that's the case with you, a simple heel lift that goes inside your shoe can relieve a lot of pressure and pain. You can see why step 1 is so important. There's no room for guesswork. This process lets us find out all possible causes of your pain, so I can apply the right treatment for you from the start. If you haven't had this kind of evaluation, consider asking your healthcare provider about it or finding a chiropractor who offers this specific approach. Once I determine the cause or causes of your SI joint dysfunction, we move on to step 2, the treatment. This is where targeted adjustments come in. I focus on specific adjustments to the spine, pelvis, and sacrum. These adjustments are the most important part of the process because they go straight to the root cause of the problem. Spinal and pelvic adjustments work by realigning the areas that directly impact the SI joint. This helps relieve stress and irritation right at the source. Without these adjustments, exercises, physical therapy, or medications can only go so far. Exercises might strengthen the muscles around the joint, and medication might ease the pain temporarily, but neither addresses the misalignment causing the pain. If the spine, pelvis, or sacrum are not properly aligned, the underlying dysfunction stays in place, and so does the pain. By making these specific adjustments, the treatment corrects the root cause of SI joint dysfunction. This not only helps relieve pain now, but also sets up the joint for better, longer-lasting function. When the alignment is corrected, other steps like strengthening exercises can work effectively, giving results that last. An initial treatment program may start 3 times a week for the first 3 to 4 weeks, followed by a gradual reduction in visit frequency. If needed, I'll add additional therapies like electric muscle stimulation, hypervolt massage, and intersegmental traction. These therapies don't replace chiropractic adjustments. They're meant to support them. They can help speed up the healing process, reduce inflammation, and improve mobility, making it easier for the body to respond to the adjustments. Electric muscle stimulation works by relaxing tight muscles and easing pain, while the hypervolt helps relax muscle tension and improve circulation. Intersegmental traction, on the other hand, gently mobilizes the spine, helping improve flexibility and motion between each and every vertebrae. Together, these therapies help create the right conditions for faster recovery and better results from adjustments. Our patients really appreciate the additional therapies, but it's the chiropractic adjustment that remains the core of the treatment. Once we start to see the pain and inflammation decrease and the chiropractic adjustments are holding and maintaining proper alignment, we move on to step 3, which is the exercise routine. I keep this routine simple yet effective, but is an essential part of the overall process. This stretching and strengthening program doesn't require hours of exercise in the office. Instead, I teach 4 or 5 key exercises that focus on keeping the lower back flexible, stabilizing it, and targeting the soft tissues around the SI joint. These exercises can all be done easily from home. Some examples of these exercises include the glute bridge, prone plank, bird dog, and side-lying hip abduction. If you do 2 sets of 10 reps of each exercise, you can get all of the exercises completed in under 10 minutes. These specific exercises work to strengthen and support the SI joint, helping maintain the progress we've made with adjustments. I've created a full video demonstrating each exercise, which you can watch by clicking the link in the description below this video. Next is step 4, which is important and cannot be missed. During the course of treatment, as we're doing adjustments, therapies, and exercises, we want to measure your progress and see how you're coming along. This is where progress exams come in, and we perform them every 10 visits. This is where we perform many of the tests we did in the initial exam, just to judge your progress. Has your range of motion improved? Are the orthopedic tests that were stressing the SI joint initially still causing your pain? These re-exams allow us to judge how far you've come and where we still have work to do. Now, there's one more step. So far, we've covered the initial evaluation, including consultation, exam, and x-rays. Then we went through the chiropractic adjustment and additional therapies and home exercise routine. We also just discussed the importance of regular re-exams to make sure you're making progress. But before I get into step 5, let me answer one of the most common questions I get asked by patients when I review their x-rays. What kind of results can I expect from going through this treatment plan? Within the first month, most of our patients have experienced at least a 50% reduction in pain. Many are already completely pain-free by this time. And after the normal 3-month treatment plan, almost all patients are not only completely pain-free, but they've also begun to return to their normal day-to-day activities, including working out, playing golf, and even coaching their kids' children's sports games, all without pain. Now, if after 3 months you've achieved at least an 80% reduction in pain, and you're finally able to sit, stand, and walk with little to no pain, and are living your life normally again, what would you want to do at that point? You'd want to maintain it, right? That makes sense? This is where step 5 comes in. Maintenance care to prevent future flare-ups and keep SI joint pain from returning. Even though you're feeling much better, moving better, doing so much more, it doesn't remove the daily stresses you keep putting on your body. So to avoid SI joint flare-ups, it's crucial to stay ahead of those stresses by keeping your spine and pelvis balanced and functioning well. That's exactly what maintenance care is for. It's helping you keep the progress you've made and staying ahead of your health long term. Now, there's no magic number for maintenance care, and everybody responds differently. But for almost everyone, a maintenance adjustment once or twice a month is enough to keep you feeling great. As you can see, this 5-step treatment protocol is comprehensive, focusing on addressing and correcting the causes of your SI joint dysfunction. And that's why it works. If you haven't started any treatment yet and are searching for a healthcare provider, look for a chiropractor who follows each element of this 5-step process. And if you already are receiving care and notice one or more of these steps are missing, consider bringing it up to your doctor on the next visit. Now, I'd love to hear from you. What have you tried that has helped relieve your SI joint pain? Let us know by leaving us a comment below. If you found value in this video, be sure to like and share it with others who may benefit. And don't forget to subscribe to my channel for more tips and strategies to help achieve lasting relief, improve your mobility, and regain control of your life, all without relying on medications or surgery. The next video you should watch is this one. It includes a full demonstration of all the chiropractic adjustments that I use for the sacrum and SI joints. Go check it out here.